When I'm on call for the emergency room, I see nothing but itises. And these itises, cholecystitis, appendicitis, and then the one thing I see a lot of is diverticulitis. Now, here's the thing about diverticulitis. The patient probably expects me to go into their room and be like, you need surgery. And oftentimes what I'm doing is going into the room and being like, you need to totally and completely change your diet, because in the end, that's the issue, right? Their diet. There was 5 cohort groups studied in a meta-analysis, and they looked at a range of fibers. In between the lowest and the highest fiber, there was a 40% reduction in the risk of developing diverticulitis. That's a huge reduction. And the highest group was only doing 30 grams of fiber, which is not that high. If you look at parts of the world that never really had diverticulitis and then became westernized, like Singapore and like Japan, they had a huge increase in the amount of diverticulitis they developed. Diverticular are outpouchings of the colon. These can come from just genetic or congenital type defects, but the vast majority of them come from having hard stool, struggling to have a bowel movement, increased pressure inside the colon, causing these outpouchings, and that could be avoided if you eat a lot of fiber. If you go up to 40 or 50 grams of fiber a day, it is very unlikely that you'll need to ever be treated for diverticulitis. And sometimes when we're treating diverticulitis, it is really bad and you need a colostomy and multiple surgeries. And it is completely unnecessary. Eat your beans, eat your fruits, eat your vegetables, although fruits and grains seem to be the #1 protector of diverticulitis.